going to ask you to share like a story about someone who, and it can be you or it can be someone else, whatever you want, who kind of was dealing with PCOS and kind of what the journey was like, but briefly, because I know I don't want to take too much more of your time, but that can be kind of the last thing that we cover.
Well, in our book, we actually share a few stories
Okay.
over the years of women that I worked with. So my story is pretty simple because I am a type A kind of person. I'm the kind of person that if you tell me that this is what is I have to do is going to help me, I'm going to do it, and I'm going to push on the gas and do it. So the minute that I realized that low carb diets and intermittent fasting and that PCOS was related to insulin resistance and that I had to lower my insulin, I went full force and I started to ovulate in 2 months and got pregnant within 3 months. After over a year of infertility, after fertility meds that weren't successful. So my story is, but it's a repetition of many other stories of people that we worked with, except that, we're human. And as I often say, nobody's journey is linear because life gets in the way. Mine, when it came to fertility, was very linear. I wanted a baby. I had the experience that showed me that following this type of diet was likely going to get me to ovulate. I did it 100% full force. And within a couple of months which is what we see. We see this 3-month sort of preconception plan. Women start to ovulate, they get pregnant. Okay. But I've had amazing stories. Before I knew all of this, I'll tell you one super amazing story. So in Mozambique, I worked with this couple. They were a South African couple. They were trying to lose weight. That's what they came to me for. They were in their late 30s, early 40s. They had been married for 13 years. They had adopted a 7-year-old daughter. 13 years into their marriage, they start to do a diet with me to lose weight, and the woman gets pregnant 13 years later, after rounds and rounds of IVF and after having adopted a child 7 years before. And so the husband wanted to know why. How is my wife pregnant? What is this diet? And I didn't know at the time. I was like, well, it's a detox. It's this, it's that. And then this woman unfortunately loses the baby and she gets pregnant a couple months later and has a baby boy. Same woman. So this was years back. So this is where like I started to develop what's this magic diet? Why are women getting pregnant? Don't go to see this doctor if you don't want to get pregnant. And so and then it wasn't just me. Like I was one person doing this. Then you start to compile stories all over the world. If you look at any ketogenic forum, you're going to get tons and tons of these success stories of women telling you that they have miraculously conceived after following a keto diet for 3 months or after doing intermittent fasting. There's a huge Facebook group called the Banting group, which is what they call low carb in South Africa. And so there's all these thousands of Banting babies of women saying, why did I conceive after Banting, which is low carb? Again, it's the idea of lowering insulin and the concept that once you eat real whole foods, lower carb, not processed foods, you have this ability to eat and stop eating. And that is the whole foundation of intermittent fasting. You eat and you stop. And that's what fasting is. You can and should do some longer therapeutic fasts for healing if needed. But the foundation of intermittent fasting is this concept of time-restricted eating, full meals, no snacks. And that's what I did. That's how I got pregnant. It was full meals, no snacks. And I think that's the major thing that PCOS women have to focus on.
Wow. Yeah, it sounds like there's tons of great stories. You mentioned a couple. There's more in the book. They're in these different forums and things. So lots of good information out there.